And now we shall come to the main lecture of our seminar, which will be delivered by Mr. Knaeblein from Bayer, and he will probably the best introduce himself. The floor.
Yeah, good morning, ladies and gentlemen. It's a pleasure to be here, and my great thanks go to Ivan. We met, I don't know, 3/4 of a year ago in Munich, I guess. And now I'm here. So thank you very much for the invitation. And it's my second time in Prague, I must admit. I was here 10 years ago at a drug delivery conference. So this comes back to the topic of Transcarbon, I guess. What I'm going to do today is I will talk briefly about what we're looking for as a company, as a pharma company, and I will then introduce you on the scouting, how we do this within our company, and then I will figure on the technology transfer initiative, and this was the main reason how we got in touch, Ivan and myself. So I want to make it as lively as possible, so if you have any questions, whatever, just interrupt me, okay? I don't know, how much time do I have by you?
How much you need? For 1 hour, 1 hour and a half. Yeah.
Not a principal lecture, so
Yeah, so it's up to you.
it's up to you.
So these are basically the topics we're looking for. We're looking for all different kinds of animal models, obviously. Then biobanking and biomarkers. Biobanking can be tumor tissue or whatever tissue from emergency rooms or you name it. And we use this for development of biomarkers. Biomarkers in the sense are stratification biomarkers to find out the best patient population within clinical trials. So our company is not working on diagnostic biomarkers. So these are the companies like Philips and Roche and then we have, I should say, left two therapeutic areas. I come from the sharing part of the company. We were bought 6 years ago by Bayer. Sharing was very prominent within women's healthcare, contraception and stuff like this, and diagnostic imaging. Both of these business models or business parts were eventually sold. So diagnostic imaging was sold half a year ago. So nowadays the Bayer company, including all the leftovers from sharing, is focusing on cardiology and oncology. And since we are working still on endometriosis and uterine fibroids in the area of women's healthcare, since these are considered to be benign tumors, they were just put to oncology. So having said that, we sized it down from 4 indications to just 2. And then I will entertain you with some corporate information regarding why it is so good to work with Bayer as an industry partner. So for oncology, gynecology, I don't want to go into the details. I've provided the slides so you can, if you're interested in, always check that. But this is usually what I also circulate to the technology transfer offices in order that they can screen their portfolio and see if there is some match, if there are some possible joint projects. And this is why it's somewhat detailed. Just want to say that animal models per se are considered for us rat and mouse and primates. So we have a housing facility within our company, and there we have rats, mice, dogs, and primates. Although primates are getting less and less over the time. And if we have to have some experiments done in primates, we usually go to big CROs who are specifically taking care of primate research. For cardiology, these are the different topics within cardiology, and also again, I don't want to go into this too much detail, but interestingly, I just mentioned this one, atrial fibrillation. This is a cardiology disease we're focusing on, and it was not easy to find a good model for this, but now in the meantime I found a good dog model in Toronto. So it's a good atrial fibrillation modeling tool to test our hormones, and also I found a mouse model quite well, which is not always the case. Sometimes you have predictivity from an animal model, being a mouse, for example, which is completely different to the predictivity of a dog model or a pig model. Another thing regarding pathology, also sepsis. Sepsis is quite complicated to work on, and especially if we are talking about models, finding models for sepsis is very, very difficult. I had the luxury to go to Nijmegen University 1 year ago. They have a big medical hospital and a big faculty, and they had one interesting thing which I want to share with you. So, when I was asking for a sepsis model, they said, well, it's not that difficult, we have our sepsis model. And then I was asking, what is the species? And they said, well, students. And then I was a little bit astonished, but the story is like that. They inject the volunteering students, I guess it's 10 nanograms of FDA-approved lipopolysaccharide LPS. And then these people, they start vomiting for 4 or 5 hours and they get really sick. But in this period, you can test the compounds if they relieve the symptoms of sepsis, right? And then after, I don't know, 8 or 9 hours, everything is back to normal status. And then I was asking, how do you recruit the students? And they said, well, that's easy here in the Netherlands. You just give them 500 euros. And then they come frequently and they are queuing, they want to be volunteers for these experiments. Because their argumentation was, well, if I drink too much, I have a hangover. I have a hangover too when I do the sepsis trial, but I get 500 bucks. So that's how it works in Netherlands. Biobanking biomarkers, as I said, we just develop biomarkers for stratification to find out the right patients, or the right patient population, I should say, for clinical trials, but not for diagnostic purposes. So this is this business we sold, I guess, 2 years ago to another big player in this area, and we're just focusing on this stratification biomarkers nowadays. The tissue is very important, and this is why we always love to work with big university hospitals who have good collections of samples. So for example, I guess I told you I was at Turku last month. They have a huge collection of samples because they are centralized in terms of the hospitals. So they have a central repository of all different kinds of samples, and they are well characterized and annotated. So for each of the samples, you know exactly this procedure, how it was frozen, how it came from the patient into the freezer, what was the background of the patient, what was the treatment of the patient, so all the relevant information, they are quite well organized. So this is very helpful for us to work with these people together when it comes to biomarkers and biobanks. Okay, this is just acute coronary syndromes and AOD. Ischemic stroke is one of our areas, and we are focusing more and more on kidney diseases. So we just hired a professor for nephrology, and he ramps up our business for kidney research because we didn't have that much experience in-house. And it's like the way of looking at the patient or looking at the disease becomes more and more complex. So in former times it was more focused on a certain organ for a certain disease. Nowadays you see it as a more systemic approach. So all heart disease and the kidney and all these functions go together, as you know. But if you look at this on a systemic or systematic, or how you want to name it, approach, it is obviously also more complex and more difficult to deal with. Atrial fibrillation I mentioned already, cardiac protection, okay, this is self-explanatory. You see the chronic kidney diseases, I mentioned this. Acute renal insufficiency, these are more of the newer indications we work with. Arterial hypertension, I mentioned before, secondary pulmonary hypertension. Actually, there we have a drug which is in clinical phase 3, which looks very promising. So, this is just a summary slide. Yeah, this is what I just said. We have this front runner, which is in clinical phase 3 studies, and looks quite promising. And then we also work on sickle cell disease nowadays and thalassemia. These are other indications which come to our portfolio. And one might think if there is a big pharmaceutical company, they have one big strategy and they stick to the strategy. This is not the case. So as everybody else, we are also opportunistic. So if we see something which doesn't fit to the strategy, but which looks promising, then we'll just change our strategy and adapt it that this compound or this indication also fits. So for example, ophthalmology, we didn't do this until 3 years ago, and then there was the opportunity to in-license a compound against age-related macular degeneration, and now we are working also in ophthalmology, which is quite new. But we had to ramp up to build up this expertise, right? And this is sometimes the tricky part. Oncology, yes, chromatin modulation, oncogenomics, tumor metabolism. And as I said before, this is not really oncology, but we consider it as benign tumors, and this is why it was put to oncology. This is something of interest. So, for oncology, it's important to work with xenografts, obviously. So what you want to do is you want to implant a human tumor into a mouse system, which is immune compromised, and then the ideal thing is that the tumor is accepted by the mouse, is bearing and is growing, and then you can use your compounds and see if the tumor is shrinking or not. But this is a little bit artificial. So what we are going after today is more to create three-dimensional human tissue-based artificial organs or artificial complex of cells. And this microenvironment is important, where you have this tumor together with the healthy artificial cells. Yeah, to cut a long story short, it's a very challenging. Oh, that's very kind. Well spotted, thanks. It's very challenging to build such models. So we are still in the infants, I should say, with these types of models, but it's getting more and more common, and also more and more scientific groups and CROs on focusing on this type of models. So, this is the summary of the oncology research areas. I guess I mentioned this one I didn't mention. So cancer immunotherapy is one of the big things. And again, here we have a compound which is in clinical phase 3. It's an antibody-coupled drug. So basically, the drug is coupled by a chemical linker to the specific antibody. And then obviously you can make it organ-specific or target-specific or tumor-specific. It's called ADC. And this kind of technology platform we're building on. So we are doing this since a couple of years, and we bought a company, Direbo, and they are very good at designing antibodies or fragments of antibodies and make them very specific by maturing them, by panning them to make them more specific and high binding antibodies. Before that, we had a cooperation with MorphoSys. One of the other might know this company. They were one of the pioneers for developing human antibodies, fully human antibodies, very specific binders. And then the cooperation was stopped, and we bought this other company, Direvo, which is now main part of our global biologics business. And this is why we have this as a technology platform to build drug-coupled antibodies as a pipeline. So this is the summary slide of the indications we work on nowadays. But as I said, this can change immediately. So maybe next time I'm here, there will be only one indication left, or maybe there will be 5 indications. No, wait, no. So this can change quite easily. So this is the sales pitch. Why should you partner with us? Because we talk science, understand business, and live partnerships. And these are reasons, real reasons why it might be of advantage to partner with our company. We have a proven track record in identifying and optimizing small molecules from the past. And we have a big compound library, 3 million compounds. This is quite big. And this is because this is the merged compound library from former Sharing and Bayer. So this is why it's quite big. I mean, there are companies around who have bigger compound libraries, but 3 million is quite something. And you wouldn't find any academic institute having such a big library. Ultra high throughput compound screening in 1536 well format is established within our high throughput facilities. Protein optimization, I just told you about this Direvo company which we bought. Antibody drug conjugate technologies, I was just explaining why this is a technology or technology platform for us. Then clinical manufacturing, this is again something which most of the academic institutes wouldn't be capable of doing. I mean, there are some, this is the exception. Cardiology with long experience, that's true, that's the Bayer experience. Strong oncology expertise, and we're focusing on first-in-class molecules, so we don't want to have this copycats. Sorry. We don't want to have this copycats, we want to have innovative drugs and being first on the market with that. Well-established oncology network, and we want to share our experience and external innovative partners. This is one here. So what else do we have? Add real value, yeah, that's true. We're flexible, that's true as well. We leave our partners room to develop and prosper. This really depends on the partner and the type of cooperation you're going for. I mean, there are different kinds of business models. Sometimes it's just fee for service. Then obviously we don't leave them all the flexibility because we know exactly what we want and we pay for this. So it's not that flexible then, but if it's a research collaboration, it's a different story, right? So there are different kinds of business models and collaboration types. We have a strong alliance management, meaning we have one department which is called Global Innovation Sourcing. This is the one I belong to, and our aim is to get innovation into our company. And one part of this is alliance management, meaning we have dedicated people who work with one cooperation partner. So for example, we have a strategic collaboration with the DKFZ, which is the German Cancer Research Center. And there we have one person dedicated to the collaborations with this DKFZ, just to have one face to the customer, and then somebody is involved in all the different types of collaborations we have there, and familiar with the people, with the details, with the processes, and it makes life easier if you have one fixed person to one fixed project. So excellent research and manufacturing capabilities, I guess I mentioned that. Responsive and committed, yes, and we compensate adequately. We had this discussion in the car when we came here. Obviously there is a difference in salaries you have in industry compared to academia. But what we're trying to do is to put enough money on the table so that there can be people working on this project which are just dedicated or only dedicated to this project, and not that they have to work in different projects because the budget is so tight. So what we're trying to do is to put enough money into the project that people are dedicated to the project and that they just work for this project for the entire partnership. And this can be that we pay postdocs, for example, or other FTEs, that we pay overheads, that we pay the material which is consumed. So really depending on the project. So this is an overview, or selection I should say, of some of the companies we work with and also some of the academic institutes. And this is obviously not complete, and it's growing day by day. So as I said, it's getting more and more important to work with outside world, meaning other companies and institutes. Any questions? No? Yes, please.
Where are your research facilities located? In Europe or in the world?
Well, there are two main research locations in Germany, which is Berlin, the former sharing research part, and then Wuppertal, which is the former Bayer part. And now the oncology is located in Berlin, the oncology research, and cardiology is based in Wuppertal. Then we have in Berkeley, San Francisco, we have the research for protein-based drugs and also the production of cogenate, which is the factor VIII product name. And they also do some research there in this area. Interestingly, I stayed there for half a year in California, not in Berkeley, but in it's not that long. Richmond. So the Richmond facility was owned by Sharing at that time, and this was for our biologics business. And there was the Berkeley facility, which is just 20 miles down the road, the Bayer facility, right? And then when Bayer bought Sharing, they dissolved the Richmond facility because it doesn't make sense to have two facilities there. So all the research for biologics in the States is now performed in Berkeley. And these are the main locations where we do research. We have other locations, obviously, where we do production, for example, but not research. And then we have part of our global innovation sourcing is in Mission Bay in California. There is an incubator where we have lab space and startup people, they can just move into this lab space and do their experiments. And then we have the first right of refusal. So if there's something interesting which comes out of the research, they offer it to us, and if we're interested, we can continue. If not, they can go to any other pharma company. So that's the business model of the incubator in Mission Bay. Then we have an Innovation Center China, which is in Beijing. And the idea is to have people, local people also working there with the academic institutes and hospitals and everything. But this also has tax reasons, because if you want, not just tax people, so you get tax advantages if you have your own offices there. But on the other hand side, it's also mandatory. So for example, to sell something in China, you have to do business in China, otherwise you are not allowed to sell any drug there, right? So this is, with the emerging markets, it's good, but sometimes it's a little bit difficult. one interesting, difficult thing I should say is India, for example. It's not that long time ago. So we have a cancer drug with a patent, and the patent is granted in India, but the Indian government said, well, this is too expensive, and they contracted an Indian company to manufacture the cancer drug, our cancer drug, with a patent in India for the Indian market. It is called a compulsory patent. And this is something we don't know how to do with it, right? So if there is a company copying our drug, that's one thing. We go to court and sue them, and then we can stop the story. But if the Indian government says to their Indian company, produce this compound and sell it for low price, then we are out of business.
What about your government?
Merkel et al. So this is one thing. There are good news about emerging markets, but there are also bad news. So, grants for targets, I want to mention. This is an initiative, this is done 3 times a year, and the idea is that we provide money or grants for interesting projects. So what we do is we put this in journals like Nature and Science, or advertisement basically, and in other journals as well to make it public. And the idea is that people can apply for this grant. And then there is a approval committee, and they screen all the different projects, if they fit to our portfolio or not. And then we give grants to these people, and there is no obligation. So the grants are up to, I guess, 150,000 euros, and you can do whatever you want for the money. But intellectual property and everything belongs to the researcher. Again, the only obligation is they have to show it to us, and we can make the first right of refusal. So if we're interested in the results, then we start thinking about how to continue to work together if it's not of interest to our company. Then they can keep the money, obviously, and continue the research in whatever direction they want.
Sorry, so the IP belongs to the researcher, and if you are interested, then he or she is obliged to give you an exclusive license? Or how does it work?
No, the obligation is only to show it to us,
Okay, and if you are
and we
interested,
can make the first right of refusal. So if we say we want to continue, then basically they continue with us. But really depends, then we start to talk about the business model and what kind of type of collaboration this will be. But if we're saying no, this is not of interest to us, then it's all theirs anyways. But I'm just saying, the IP belongs to the researcher, so we don't own anything. We just provide the money to see if this interesting idea after 2 years leads to something which may be something worse for translational medicine. And
okay, what about, if you say yes, we are interested, and you start to discuss the business model, and now let's suppose that the researcher asks too much money for his IP, because IP is it. So, what's your experience? Does it happen at all, or it's always goes smoothly, or?
well, of course, with us always it goes smoothly, but to be honest with you, I don't know.
Because researchers are, scientists are sometimes complex people.
Yeah, no. I don't know. I'm a researcher by myself, so
Yeah, I don't know what it was.
thank you. So the idea is, we do this since 1.5 years now. So there is no history I could draw on. Right? I guess I said so after 2 years approximately, then they start showing what they have done in the past. So we are still waiting for the first results from the first grants which we provided.
Is it limited to German universities or
It's worldwide. This is what I said.
is it open, for instance, for the
Everybody.
Faculty of Pharmacy of Heidelberg?
For everybody.
Ah, that's interesting.
So you can look it up on our webpage, and there they also say the next deadline, and they also tell you the forms which you need to fill in. It's not much. I mean, it's kept as simple as possible, because we don't want to bother people with this.
Seems to be very interesting.
May I ask you, how do you keep the researchers from the urge to publish? Because the researchers are evaluated mostly according to the number of papers they have published. The PhD students must publish to defeat their thesis. How do you keep the researchers not to publish?
Well, I mean, this is an intrinsic question, I would say, right? So publish or perish is obvious for everybody. It's up to them. I mean, if they think during this 1.5 years or 2 years they found something interesting which they want to publish, they just publish it. But we will never ever do business with them, because for us it's useless. But it's up to them. And I guess this is just a matter of educating your scientists at your university how important it is and what is the right time point to publish. I mean, it's you can do both. You can secure your rights by writing up a patent. It's important to have the priority date, and then you can publish it. No problem. You just need to know how it works, and you need to know how the process works. But this is a matter of the universities to teach their researchers how to do it. I mean, I've experienced lots of cases where the people published without securing their IP. And then later on, most people feel very terribly sorry that they were not informed by their university how you can do both, publishing and patenting. But to make it short, for us, we don't care. I mean, it's a decision by the researcher, and they have no obligation. If they think they should publish, they publish. But then there's no way to do business with us.
So generally say you have the same problems, that unbalance between protection and publishing. So it could happen both in Germany too.
Yes, of course. I'm talking generally spoken about this problem. We have it in Germany as well as we have it in other countries. Right? But I must admit that nowadays universities, they take care of this issue by just teaching it that there is a solution to this problem, right? Or making the awareness, because a lot of researchers, they are not aware of this process of filing a patent, and it's not their world, so to say, right? So you need to raise the awareness, and this is, I think, is the responsibility of the university. And as I said, in Germany, they are, nowadays it's more or less mandatory to, or it's regularly done within the lectures that they also teach people how this stuff is publishing and patenting it.
Okay.
Okay. Everybody knows aspirin, I guess, right? Okay, let's skip this.
For how many years do you sell it? That's more than 100 years.
100 years, yeah. And the thing is, Bayer is very good at marketing for aspirin.
Yeah.
If you remember how simple this drug is, and it can be used for and against everything, right? They're very clever at this. So.
Do you think you would be able to register aspirin this time with its, like the breathing problems? Because it's very strong drug, it's very good. But
well, it's just a matter of the dosage regimen, right?
Yeah.
I mean, you wouldn't get any bleeding disorders if you just take one pill once a day or so. If you have a high dosage over a longer time. And I mean, on the other side, people use it just to get to thinner their blood to protect themselves from heart attacks and strokes, right? So this is really how you purpose or how you
Well, in a way, aspirin is a synonym for Bayer. That's
everybody
fine,
knows aspirin and
Yeah.
everybody knows bioaspirin. What do you mean? They use it for heart protection nowadays. They use it as bubbling whatever tablet. They use it in combination with vitamin C. So there is nothing you cannot treat with an aspirin tablet. No, I'm just kidding. But and you see, it's has a big market still, right? Plus, obviously, since this drug is so old and all the patents have gone, and there is a huge generic competition, still the people like the brand aspirin, they like because it's Bayer, it's the original, right? Which is different with other drugs. But for aspirin, it's true. So, we have three different divisions. One is the material science. This is colors, paintings, plastics, foils, acetates, everything. Then we have the crop science, which is everything related to agriculture, being it fertilizer, pesticides, herbicides, you name it. And then the biggest part in terms of revenues is the HealthCare business. This is the part I know. So, now that comes the part with the technology scouting. Any question? Oh. So, the scope of technology scouting is, I mentioned earlier, compounds, also everything which you consider important for a research-based or innovative pharmaceutical company. So these can be animal models, compounds, PET tracers, cell lines, tumor tissue. So everything basically you need is something which we are interested in. Then the clients are internal clients, like early research groups or individuals or project teams, which are asking for certain technologies or compounds or models they need. The sources are institutes, universities, technology transfer offices, publications, electronic materials or contents, so everything we screen. And very important is site visits and personal communication. So what I usually do is if I go to conference, I always meet with people at the academic institutes, which are more or less nearby, so to say. Or if they're not, then I just plan the journey that they are. So for example, I joined the autumn conference, which is the Association of Technology University Manager, every year. And last year it was in Orlando. And then on the way to Orlando, although it's not really on the way, I stopped by in Cambridge and then visited MIT, Harvard Medical School, Dana-Farber Cancer Institute, Massachusetts hospital and all these things. So it's always good to make an efficient trip. So important is to what we call the innovation gap. So to communicate about the maturity, what we are looking for in terms of mature technologies. And this is done by taking part in conferences, sitting on a panel, tell people what we're looking for and also what we're not looking for. Networking, personal contacts, I said already, efficient trip, I said this as well. And obviously also leveraging from internal resources. So if people went to a conference and found something interesting research topic or interesting academic group, they just tell me and then we can do the follow-up. Okay, this is how the technology scouting evolved. So we have this now since 4.5 years, and it started with receiving offers from universities, but they have often were far-fetched, so it doesn't fit to any of our indicators, I must admit, so it was a very promising approach. Then I started screening databases, and we had this on the way here, the discussion. There are tons and thousands of different databases, and it's a very Sisyphus work to screen all the different databases which are available. Plus, the tech offers which are put into the database are not necessarily up to date. So it's the problem with every database in the world. If it's not somebody who takes care of it and has some criteria to maintain the data, keep it up to date, then the database becomes useless. Then I was asking at the technology transfer offices, telling them what we need and what we're looking for. And then the last part is what we call focus scouting. So I have a specific request and I go to a certain technology transfer office. They screen their portfolio or their academic researchers, and then they bring me in touch with an expert of choice. And then I figure out this is the right person, or he guides me to the next expert who is really the guy I'm looking for, or is really doing the research we need for the certain project. So just a summary on one page how the process works. So these are the sources, as I mentioned, universities, technology transfer offices, publications, and so on. These are the internal customers, the research groups, the business units. They address their needs to me, and then I start scouting for what they're looking for. Internally, we have so-called team rooms, so all the information I find which fit to the certain needs, I put in certain team rooms, so then the project teams have access to the certain technologies and can get an update as soon as there's something new in their team room, in their specific team room. Then we have the scouting presentation with the needs, which is always updated. This is why I wrote the date on the slides, because, as I said, this can change within short period of time. So it's always important to have the date written on it when we are looking forward, because after half a year it can be quite different already. Then obviously I use the buyer organization as a multiplier, so they also distribute the things I'm looking for, and they also tell me if they found something interesting at whatever conference or workshop where they went. So using the internal and external network is of utmost importance. Just to give you an idea, by screening 10,000 tech offers, so sometimes the question is from an academic institute, well, you sent me something and then we didn't hear from you for 2 months, let's say 2 months. And then I need to explain obviously why they didn't hear anything, because it's quite simple. If you understand this slide, then you will understand why it can take a couple of months to get an answer. So from 10,000 tech offers, there's one filter with precise and tight criteria, and this is my judgment, my evaluation of a certain technology. So if I think it fits to our pipeline or project portfolio, then it goes to the team room. And here it's on display then for my internal colleagues. So the next filter is selected by the business unit or by the functions. So the scientists are looking in the team room or are presented at the project meetings, and then they decide if they want to continue or not, or they say, well, this might fit in half a year, or no, we just changed the scope of our project, we don't need this anymore, or no, we found something else, something better, which is more useful in the meantime while you were looking as well. So there are a couple of reasons and different scenarios, obviously. So once there's thumb up and we want to continue, then the next is the conditions and resources. So you need to find a sponsor within the company, And you need to see, so for example in oncology, we have more than 100 projects. If you look at the preclinical setting, toxicology, and then if you look for the clinical trials, different phases, I would say it's about more than 400 different projects we are running in parallel. So the head of oncology needs eventually to decide if he wants to get this new project which comes from outside, if it's better or equal or worse than the internal project. And then it depends on the maturity status. So there are different criteria, different reasons why you would decide to go for an outside project or not. But what I'm trying to convey is you need to make a fair balance between the outside offer and the internal availability. And then you make a fair judgment if you go for the outside opportunity or if you continue inside. And this is, if you consider how many people are involved in the end, and basically this is something which needs to be decided by the head of oncology. Sometimes if these are bigger projects, these are decided by the board. So it really depends when the next board meeting is together with the oncology head and where they have a time slot to decide on this project. This is why this entire project can take quite some time. So this in-house buyer, okay, this more technology transformation.
Did I miss it, or did you give them the remaining number? That means out of those 2,000, after 3 steps of filtering, how many deals or ideas remain?
5.
5.
So for the first, from this 10,000, there might be approximately 300, which are considered to be worthwhile.
Other effort?
Valid. Yeah. Then for the next one, there might be maybe 50. Then to find a sponsor at a certain time for a certain project compared to the current internal portfolio, maybe 10. And then you also need to start discussion, negotiation with the outside partner. As you just said 15 minutes ago, so scientists are, what did I say?
Complex.
Their own brand of people or own breed of people. They sometimes have, how would you say this to be polite? Unexceptional, no. Unexpectable, no. So,
Very specific.
just one example was, we made an assessment about the worth of a certain technology. And there was 2 orders of magnitude between what the researcher was thinking it would be worth compared to what we were thinking it is worth, right? And that's a bad starting condition, right? So, I mean, if 1 order of magnitude is one thing, but 2 orders of magnitude, that's quite a...
You were offering more, yeah?
Sorry?
You were offering more.
More than 100 times, yes.
And this pipeline, 10,000, that's how fast you get it? That's 1 year or in 10 years? Or?
This pipeline,
Yeah, this pipeline, yeah. This 10,000, what period of time does it concern?
well, this can be from 2 months to 3/4 of a year, really depending on when I present it to a project team, when they consider it worthwhile to continue.
Yeah, no, I meant how fast you collect these 10,000 offers. Is it for a period of 1 year or 10 years or since the since bio was created?
No. This is since the 4 years I'm doing this job.
So that's something about 2,000-3,000 per year, let's say. Quite some,
And also brings me to one point back which we discussed earlier, the technology transfer offer. Right? So if you consider how much offers I get, and then you get something which is a 30-page PowerPoint presentation and you don't know, do they want to show you something? Do they want to ask you something? Do they want to sell you something? Do they want to buy something? They don't know, because it's not obvious from this presentation.
You need elevator pitch.
And this is why we are trying to harmonize this technology offers, right? Because it makes life easier for people like myself and my colleagues in other companies to get a higher rate of screening this. And this again helps everybody involved in the process, being in academia or industry.
And what's your team, or do you make all the filtering yourself, or do you have those, let's say, 2,000-3,000 per year? How many people are involved in this procedure?
Me, myself, and I.
That's good. Yeah, okay.
May I have another question?
Yeah.
So the output of this pipeline are projects where Bayern would like to, let's say, launch these products in the market. And are there somehow also, or this process is also creating the startups where the researchers start their own companies and let's say start these projects on their own way? No.
This is the procedure or the process from this tech offers to in-licensing a certain asset, a certain technology, or to start a collaboration to work together with a partner on a certain project, but not any startup activities. Yeah.
I have a question. When you say to start a partnership in a project, how would at the final of the project resolve the situation with the intellectual property? So there is a team which has some rights to the result and your proportion of rights, so you share the patent rights, for
Yeah,
example.
joint IP.
Yeah.
Yeah.
Is there a
That's part
problem?
of the contract. I mean, you have to negotiate a lot of things if you start a collaboration, right? And you need to evaluate what is it worth and what each of the partner brings to the table, right? And based on this, you prepare the contract and then you decide by the joint IP in what percentage it belongs to one party or the other.
How do you evaluate the portion of the ownership of the property?
Well, we have a lot of experience with our products and how they were created and how IP was structured and filed and everything and generated. So I guess we have a good overview from our internal processes, what is a fair evaluation, and then we make a proposal and then we start discussion on it. And it's really a case to case. The same with this, what you're willing to pay for a certain technology, right? So the case I just mentioned, where we had a factor of 100 different expectation on the worth of a certain technology, then it becomes hard to find a solution and start a project together. So this didn't happen, obviously, right? Because one thing I must admit is, and this again brings me to another point we raised earlier, a lot of academic people don't have a, how to phrase this, the rough understanding of the pharma development process. So they have a smart idea, they have an excellent project, they found some very exciting technology, but they don't know how this can be used in the pharma development process. Because they don't know that you have toxicology running, that you have to do escalation studies, that you have in vivo studies, in vitro studies, that you have assay development, then you have clinical trials, phase 1 to 3, and they are not aware of this, which comes after having a technology at an early stage, but then developing a drug out of this is a completely different story. Plus, this only is true for a compound. If we are talking about a technology which helps you to develop drugs, it's another completely other story again, right? And this awareness is not there. And this is why sometimes there is so much difference in evaluating the value of certain technology. But again, it's just a matter of sitting together and start talking and find a solution. Sometimes it works perfect, sometimes it doesn't work. Then that's life. I mean, it's like everywhere else in the world and everywhere else in whatever area you're working in.
There is a quite difficult situation with the partnership when you own the patent both. I mean, the research institution and the company. Is it often case, or do you try to get most of the patents on your side?
No, as I said, it's a case by case, it's completely different, right? It really depends how much in terms, at the beginning of the project, how much in terms of input comes from which part. So if this is something which is brand new to us, and we are seeking for experience or expertise, then obviously we don't have any know-how, so there's nothing we can bring to the table in terms of IP, right? So it's completely the partner. If this is something where we have a lot of experience, like in oncology, for example, and we need a certain technology which was developed for oncology, let's say for fishing stem cells or circulating tumor cells out of the bloodstream, there are institutes and researchers working on this, and this is a technology which is interesting for us. So there we have a specific technical know-how from this researcher in terms of fishing out circulating stem cells, and we have the rough knowledge of oncology. Then we bring it together, and then we see when the IP rises out of the project, how should this be divided.
My question was regarding the situation in Czech Republic, maybe it is specific because the company they want, which want to cooperate with us, they say we must be the owner of the patent as a result. So my question
well, this is not specifically Czech, this really depends on the company. I mean, I know a couple of companies who think
so
the same.
My question was, how do you deal with the situation if it's comfortable for the company when the owner of the patent are both a research institution and the company? That was my question. If it's comfortable for both of you to deal, to work together, to make a business with the patent and to share the results from this cooperation.
Yeah. This is one of the two sales pitch slides I showed you earlier. There was this point mentioned. So we are trying to be a fair partner, so to say, and work on a cooperative way. Right, so what we're not trying to do is to force people to a certain situation, and we don't want to, what to say, it should be a fair partnership with the potential to keep it running as long as possible, right? And this only works if you start in the very beginning with a fair negotiation, with a fair attribution of the IP, for example, or distribution, I should say. And if you have a fair compensation and everything. All the points I mentioned earlier are meant to make this as fair as possible for both ends, right? And also it's a matter of reputation. I mean, if Bayer, for example, screws one of the collaboration partners, academic partners, then their good reputation can be lost just for one occasion of a bad collaboration, right? So this is something we don't want to happen. We want to avoid this. Because, as I said, the trend to get more and more innovation from outside is getting more and more. So we rely basically on external innovation which we get into our company, and this we are only capable of doing so if we attract people to work with us.
But still, from time to time, it surely may happen that the original expectations are not met. And the opinions of the company and environment and the academic institution may differ or may diverse. Yeah? Did it happen that you have to go to the court to sue an academic institution, for instance?
Not that I'm aware of. I mean, maybe Bayer.
Always able to solve it smoothly.
Yeah, to be honest with you, I don't know. So, I mean, as I said, I was with sharing, and we were bought 6 years ago now.
Okay, so
From the
the last
sharing
6
past,
years, let's say.
from the sharing past, there is none of these cases. From the last 6 years, I belong to Bayer. There is no case I'm aware of. If there was something in the past, could be. Honestly, I don't know. I wouldn't rule it out because this can happen, obviously. Right? And
Can I ask? Sorry. Please.
Maybe it's your secret, but what is the appropriate proportion between the drugs you get from external sources and your own inventions?
the proportion,
Yes.
I would say 1/5 is from outside,
And
and maybe half is with some help, collaboration with outside. So I would say approximately 50% is completely Bayer internal.
So if I can have a question. So if you are looking for technology transfer, so what do you prefer, to buy the new technology or the license the new technology?
There is no general answer to this. I mean, if this is a certain technology, okay, let's put it this way. If we think this technology is very crucial also for other pharma companies, then we would buy it to be the exclusive owner, to prohibit others to work with the same. If we think this is something where it's nice to have, then we just take a license. Or the other way around, I mentioned earlier, MorphoSys, for example, is one of the big cheeses regarding antibody development, and after our collaboration stopped, we bought the company Direvo. So we basically bought the technology provided by Direvo, which is operational evolution, something was, directed evolution approach from Manfred Eigen, who got a Nobel Prize for this approach a couple of years ago. And he is a co-founder of this company, actually.
Thank you.
Does this answer the question?
Yes, sure.
So it's always so, could be like this, could be like this. I mean, there are no general answers to this. Right?
Yes, sure.
But it's also a message.
Yeah. Okay, I was giving a presentation on exchange and transfer between industry and academia, and I was talking also about some areas of improvement, I would like to call it. And then a guy from Novartis came after my presentation and said, well, this is exactly my experience. So I couldn't agree more. And then we were discussing our experience we had in terms of collaboration or interaction, I should say, with academia. And then we spotted this was quite a common ground we had. And then we were saying, well, probably it's not just the two of us from Novartis and Bayer, probably it's the same with other pharma companies as well. So I invited some other guys doing similar jobs in other companies, which was then Merck Serono, Boehringer Ingelheim, Merck Sharp and Dohme, and now also Sanofi is in this group of people. And then we were discussing our experience, and we came up with 3 basic points where we have potential or see potential. So this is the one I said earlier. So there is no template for technology offer, right? So sometimes it's a 30-page presentation, as I mentioned. Sometimes it's a flyer, very crisp, hard data, 1 page. This is the ideal thing. And also from the technology transfer offices, it's very different what you see and what you get from the different offices. So our idea was to get some harmonization for this technology offers. So the skills, education, background, motivation, overview, and research activities. So in some technology transfer offices, you have people working who do not have any scientific background. Maybe they have a background in humanities, and they should work with you on out-licensing or in-licensing or partnering of pharma-specific things. I mean, this is something which couldn't work, right? So our idea is to have people as our counterparts in the technology transfer offices who have a scientific background and specifically a pharmaceutical background. There is no central portal. I briefly touched on this already. So universities have their own collection, repository of technology offers. The technology transfer offices have their own database. Then there are Patentvermarktungsagenturen. So they sell patents on behalf of the universities. They market patents or technologies for the universities. They have their own databases. Then there are regional databases. Then there are societies like Autumn, they have their databases. Then there is iBridge, which is a foundation. So there are tons of different databases, but no central one. And our idea is to build a central one. Right now we're trying to do this on a European level. So one central database for all the universities, all the technology transfer offices can put their technology offers, the harmonized tech offers, into this database. And then the process becomes easier for everybody participating in this, because for academia, they know where to put their technology offers, that it will be found by people looking for certain technologies. For people like myself, it becomes easier because I don't have to go from one page to the other. I have a central repository of technology offers. So that's the idea. And we started working on this, and we'll extend this, and then we run a prototype, and then this prototype will be tested, and then we'll start the rollout and approach academic institutes all over the world to make them aware of this database, but also to tell them about the benefits if they use this database. I mean, this really lives, this database, or the value of this database is only if a lot of people, a lot of institutions put their technology offers into this database. So that more people are using this, that more prominent, that more popular, and that more useful is this database, right? So that's the idea. Yeah, this is another point. To create a curriculum for technology transfer, people specifically for pharma. I will talk about this in a minute. Okay, so this I mentioned, most important biology, pharmacology data, efficacy profile, tox profile, all this data should be kinetics, pharmacodynamics, toxicology, gene farm, IP status obviously, so who's the owner of the patents, and further information can be links to existing patents, links to publications and stuff like this. But the idea really is to squeeze this on one page. That's sometimes the challenge, but it's possible. I've seen it thousands of times. You just need to really highlight the highlights, right? So to squeeze it as narrow as possible. So the data. Yeah, this is the point we just discussed here regarding the IP. So what will you do with the IP which is generated during this collaboration? This needs to be part of the contract, obviously. Then, what are the milestones? What are the options for exclusivity? So I told you with this grant for targets, for example, all IP, so they just receive the money. What they do with the money, I mean, they can hire a postdoc, they can use it for consumables, they can use it for renting lab space, so it's up to them. We don't influence this. We just put the money, and then after 2 years or 1.5 years, we start looking for the results. And then obviously the IP belongs only or solely to the scientists. But if you go for a collaboration, it's a different story, obviously. Any questions to this? So, points for discussions. Technology transfer portal, as I mentioned before, harmonizing technology transfer by using the existing. These are the Patentverwertungsagenturen, which are the marketing offices for technology offers per state, with respective professional skills and education. This is regarding this curriculum. And we said also, and we are also talking to the European government regarding this curriculum, because it might make sense to make this mandatory. So for everybody who comes from academia, who wants to work in the technology transfer office, to have a graduate in pharma-specific tech transfer. So this is something which is still under debate. Continuous training, yeah. So what we want is to provide a training course for pharmaceutical specific technology transfer. And this is the, you mentioned the Proton earlier, and ASTP is another organization taking care for certification of technology transfer. And what we're doing right now is we are combining modules, teaching modules from Sanofi, Boehringer Ingelheim and Bayer. And these are courses which we train for new employees. So it's a new employee training, which is different in the 3 companies, but it's about the same topics, obviously. And we bring this together to make one pharma-specific, or some pharma-specific modules. And then we want to combine this with the technology transfer modules from ASTP, from other associations, and merge this and make it a pharma-specific technology transfer module or curriculum. That's the idea behind it. Harmonization, talk about skill set. Yeah, this is also a discussion we had when we came here by car this morning. Jack of all trades. So I don't know if you're familiar with this wording. This is somebody who knows everything and can perform and can do everything. So in any area, in every situation of life, this is considered a jack of all trades. And why is this? Because from a person working in technology transfer, you're expecting a solid scientific background, you are expecting knowledge about legal aspects, you are expecting knowledge regarding the IP situation, you're expecting negotiation skills, so you're expecting a lot. So somebody needs to have a lot of skills to be a good technology transfer manager. But, I don't know the equivalent here, but BAT 2R in Germany is a PhD salary. And you cannot expect people working for a PhD salary in a quasi-industry environment, right? So this is another topic which we addressed with the European Union or Commission, that they create a fund where they put some money, or which the universities can use to get some money to get a higher compensation for their employees, also to hold them, right? Because it doesn't make sense to have a high attrition rate with people. So then we have somebody who was working in technology transfer for a university since 2 years, so he knows all the people, he knows all the projects going on, and then he's gone, right? So then there comes the next guy, you have to teach him, he needs to build his own network, and this is no good for nobody working in this process. or nobody involved in this. So this is why we're also saying there needs to be some, you need to level up the income of people working in academic technology transfer offices. Yeah, these are negotiation skills are important, sound understanding of the pharma development process, understanding of regulated environments like GMP, all this is mostly unknown to most students. I mean, I don't want, I know from my own past. This is something you're not, as a person working in the lab, you might know this one, but probably not the other ones. Sound understanding of IP principles, including the OMPI Inventions Act. I don't know how it's the IP situation here. It changed in Germany.
It's similar like
Okay. Then the basics of contracting, as I said, so how to negotiate, what is the legal framing for a contract, and what is the legal language. I mean, for scientists, it's not necessarily normal to understand a legal contract and the fine-tuning of the legal language. So, what happened? So we had a meeting with this is a group of people working in technology transfer in Germany. So I guess these were 30 people, technology transfer manager from German universities or academic research institutions. And I was presenting this, what I showed you earlier in the slides, these 3 areas of improvement. And they were very open about this, and they were very happy that there is an initiative coming from industry to help improving this interaction between academia and industry. So we decided to meet again to report regarding the progress. And then there was another meeting with also people from technology transfer offices, but also this time some other pharma colleagues. And this was done at Bayer in Düsseldorf. And this was during the Medica, which is a medical fair. So we used the date and the location. And then we used the rooms from Bayer Innovations GmbH in Düsseldorf. And there were so many people, they wouldn't fit into the room. I mean, we were taking chairs from all over the building, squeezing it into the room, and there were so many people because this topic is so important, right? And they realized this, people from academia and from industry, that there is really a lot of pressure to work on these topics. So this was a good start. Then, this is where Ivan and myself met, was this UKTS meeting, and there was, I guess, Leon Stefanux presented this because I was stuck, my plane didn't show up, so I came late, and then I asked my colleague who had the presentation to show it, so he was giving the presentation. But I showed up later on, but at that time the presentation was ready already. And then we were discussing about next possible steps. So this is a curriculum provided from Johns Hopkins University, which is the world's biggest university hospital. And they have a big technology transfer office, and they have their own curriculum. And this is just a snapshot of the different topics they address there. And this is something which helps us as a guidance how to set up this course. I mean, we don't want to reinvent the wheel, we don't want to start from scratch, we just use what is available and do what we call blending of the best. So you take all the bits and pieces together, and then you create a pharma-specific technology transfer curriculum. Market research, obviously also one of the topics how you introduce scientific into the market, business planning, obviously. So these are modules from the Johns Hopkins universities. So if you look at the different courses which are available, you find courses with a different focus, but usually these are the main topics how this course is rendered. I guess this was it about the technology transfer activities. So, to wrap this up, I guess maybe it's important to have a good interaction with academia, and it's good for academia and industry, for everybody who's involved in this technology transfer process. It's good to have some common ground, some common understanding, and also to have some common goals which you are aiming for to improve technology transfer. And this again helps everybody who's involved in this process. And what we found out after discussion when we shared our experience from the pharma colleagues were really these three topics, which is this harmonized technology offer, which is the central location for technology offers, and which is this pharma-specific technology transfer curriculum. And we are addressing all three. And I'm quite positive that there will come up something in the near future. I mean, with the curriculum, we are quite far advanced. With the central database, that's the toughest one. Yeah, because if you want to do this on a global scale and you want to invite everybody who is producing technology transfer offers to provide this into a central repository, in the end it will be convenient for everybody, but it's a long way to go there because you need to address more or less everybody who has something to offer to put it into this database. On the other hand side, I think this is the feedback we have so far. Everybody agrees that it's worthwhile to have such a central database. And for an academic institution, it's good to know where the central repository is, because then the likelihood that a pharma or another partner finds something which you offer of interest is growing, right? So for example, if there are 10 pharma companies using the same tool to use for a technology offer, then the likelihood is 10 times higher if you have this in this database, because you have so many people looking at the at your technology offers. So that more popular this database becomes, that better it is for everybody involved in the process. With this, well, yeah, if you have something to offer to our company, now you know what we're looking for. I'm very open and would very much appreciate this. And thanks for your attention, and I'm open for questions.
Thank you very much. Questions? I have two questions. First, this training focused on pharmacological field. I fully understand the training of your people, but how many people do you feel are there to be students of this course? Because when I compare it with the either ASTP or Proton curriculum, they are obviously much wider, because if you have in mind technology transfer officers from the university, then of course they need to know a lot of other things than just pharma focus, because they are students and they may copyright this software, etc. So if there are about 30,000, that's an estimate, 30,000 KT professionals in Europe, so possibly the portion of those people that need your training would be much less. So that's 1,000, I don't know. Do you know? Because the question is that this is suitable for your people, but for instance for people from Mr. Fuchs' KT office or from my company, private advisors, it's too focused.
Right, this is just a, how would you say it, specialization, I should say.
Yeah.
So the idea is to specialize it for pharma. So if you need to do two parts of the course, right? So you have one integral course, which is technology transfer and pharma, and then you need to have the pharma module, which comes on top of people who are certified in technology transfer already. So everything else doesn't make sense, right? And how many people there will be in the end, I don't know, honestly. And I don't know.
Thank you.
I fully agree with it, because I think it's something like the pharma is something like what's upper,
Yeah.
that basic, because there are plenty of procedures and knowledges, what you have to know, and then it's specialization pharma. Yes, I fully agree.
So you need to have the choice to either make this integrated, fully blown up technology transfer pharma curriculum, or you just attend the courses. I mean, we don't even know exactly where to teach it. We don't know yet how much time you would need for participating. As I said, it's still in starting assembly, right?
Yeah.
But we are right now at the collecting all the available modules to create this course. And then maybe in 3 months, I can tell you much more. And then we also talked with Christian Stein from ASTP. We want to do this in close collaboration with the ASTP, obviously, you know, which makes a lot of sense.
You will see my last presentation about what was done on Charles University together with Mr. Dvořák, and I expect the second block of presentation, which will be here from Hradec. So maybe you can make a broader picture about the local Czech activities, what was done and what we plan to do. Yes.
Well, possibly the last question. What?
Ivana, můžu tě zastavit? Question is behind you, so if it's okay for you, there is one question.
And so coming to the problem of the problem identification, you have shown here, for instance, some specific situation as a multi-organ dysfunction syndrome, shock lung, etc. There are some, for example, there are some very hot topics for the future. For instance, in the critical patients, there are just in this patient are spent so much money. This patient are spent 3 weeks on the ventilator, a very aggressive treatment, many X-rays. For instance, one spiral CT is 1,000 normal X-ray. So as it's very aggressive. These people are just surviving their own death. After this, there is 5 years very high mortality. So as everything, this is for nothing. So my question is, who is, for instance, identifying this problem, because we know that it's just in connection to DNA damage and telomere shortening, and it's possible to identify. So as how to decrease, for instance, iatrogenic effects, and how to prevent this by new drugs, etc. There are some view for this. It will be for the future, for instance, the huge area for the development for new drugs, etc. So as who is in the companies identifying this problem and decision maker? If this area is interesting for the company, and there will be invested money, and there will be just this strategy or just this way.
So eventually the short answer is the board. So the board decides what to know. And scientifically we have a lot of specialists in oncology, and they discuss with which areas to go. They discuss it from the scientific rationale. Then we have people from marketing. They make a market segmentation, evaluation. They will check out the market potential for a potential drug. Then we have people in project management and risk management. They will make a calculation how is the likelihood to get a drug on the market. If scientifically everything goes well, if the attrition rate is normal compared to other in-house projects, if the timelines are comparable to other projects, on these assumptions, they make a calculation. If this drug would show up in, let's say, 8 years on the market for a certain patient population, would we have a market? Would we have a chance of a market? How we have people from competitive intelligence, they know what the competitors are doing. I mean, not every tiny detail, but they know at least in what direction their research is going. So they know about the pipelines of the competitors. So this is another factor which goes into the assessment if it's worth to continue with a certain indication, with a certain drug development. If there is a competitor which is at a certain point of maturity with a compound already, we will probably not go into this. On the other hand, if this is a huge market, there can be also a second drug on the market still making revenues for the company. So there are so many things which factor into the decision to go for a certain indication or not, that what I said in the beginning, the board makes the decision. I mean, you have lots of people, as I just mentioned, the different departments, who all are part of the preparation for a decision. So they make their work, their specific work, and then this comes together in a package. This package is presented to the board, and then the board decides. So the short form is, the decision is by the board, but there are lots of different activities which are carried out before this decision is done. And a lot of different experts and expertises which are needed to prepare this decision package. Does this answer your question?
Yes, and what is, I think, the average, the time or time horizon for this decision? I mean, if, for instance, the second example, there was decision to use MCT oils for the total parenteral nutrition in Fresenius. There was decided to not to develop this. After this, all companies went this way, and that was a huge loss for the Fresenius at this time. So, as what is, for I think, the expected time for to get this decision from the side of this provider?
Well, if the board is asking for a package to be prepared for decision making, it goes within 2 weeks. If the board is asking for it, so if it's top down, it's 2 weeks, let's say. If it's bottom up, it can take a year. So again, there's no general answer to this because it's always it's a case-by-case thing, and there are so many factors always which go into a certain project.
Thank you.
Okay, are there other questions? Seems to be no, so thank you, Mr. Knaeblein, very much for your nice presentation.
Welcome.
We learned a lot, and I hope that we shall make use of it in the future contacts with Bayer and DT Pharma. Now there is a schedule half. We should have a break for half an hour. Now the question is